My name is Bill Lee. I practice age management medicine here in the city of Centennial. I've been doing it for 39 years. I was born in Sioux Falls, South Dakota, but grew up in Topeka, Kansas. So I'm a wheat belt guy. I trained in Los Angeles and I liked Los Angeles. We were living on the beach, that's kind of a fun time. But I realized I couldn't raise a family there. So I looked all over the West Coast and Denver. I had a grandfather growing up in Kansas. My grandfather lived in Boulder and he was a wheat farmer. And we'd come out and visit Grandpa all the time. And so I got to know the mountains. He'd take us up in the mountains and my brother and I climbed this and that. So I kind of liked Colorado. So when it came time to try to decide where do you want to spend your life, I thought this would be a pretty cool place. I have a whole bunch of kids. I fathered 4 and I have 4 stepkids. So that's eight kids, but they're all grown up now. The youngest one is Alex. Alex is now 26. He has severe autism. He has no language. And when he was born, he was about 2 when we figured out it was autism. Medicine had nothing to offer. And so I started searching around in alternative medicine, trying to find a solution for this child. I guess his gift to me was he brought me into alternative medicine. And that's when I started on this journey of age management, because a lot of it is alternative. I could not decide in college what to do, so I majored in economics, thinking I'd do business or law. And then tail end of my junior year, a friend talked me into taking an anatomy class with him. And I loved it, and I was one of those kids that you hate in classrooms because they're doing so well. And my brother just applied to medical school, and I thought, well, I can't decide what I want to do. I like science, I like people. Let's go to med school. There was an instructor, a professor, whose goal in life was to have a pun in every sentence. And he was about halfway there. He was so much fun that I almost went he was an infectious disease doc. So I almost did that just because of that. And I realized that was kind of stupid to do it just because of one professor. But he was a guy that brought medicine to life and had a lot of fun and kind of learned, medical school is pretty strenuous and rigorous, and mind your P's and Q's and don't get into trouble. So here's a guy that kind of made it all different, made it a lot of fun. And that was very much a relief and changed my outlook on medicine. Also, when I started learning about alternative medicine, a flyer came across my desk for anti-aging. I thought, what in the world is this? For some reason I went. It was an A4M meeting back in the early days. And I went and I spent 4 days sitting there trying to keep my mouth from hanging open from all the stuff I was hearing from these speakers about what we can do to delay, reverse, age better. So I was introduced to anti-aging in that way, and I was fascinated by it, so I went to more and more meetings and learned more and more. What I really had to learn was nutrition, because MDs get no nutrition. We had 1 hour, I think, and they talked about this is a protein, this is a carbohydrate, this is a fat, and that was supposed to be nutrition. So it was very, very, very weak. So I had to learn a lot of nutrition. I've been an athlete my entire life, so I knew some things about exercise, but I had to learn how to kind of put it together in a better way. And then the intricacies of hormones. I knew a lot of it because OBGYN is, menopause is highly involved with hormones. Infertility gets you into hormones. So I knew quite a bit about that, but I had to learn more. So it was quite a transition. I spent a lot of time, a lot of money, going to courses and learning this new stuff. Well, medicine, when I was a puppy, was really kind of like Marcus Welby, MD. You know, it was a close-knit feeling with your patient, and spending time and knowing a lot of the family, and it was just very, very nice. What has evolved, much to my chagrin, is we are now, physicians have been cut back and cut back and cut back economically, that you cannot survive unless you do something different, something out of the ordinary. And what a lot of the docs are going to is being employed by hospitals. That is totally not what I want to do, because then the hospitals dictate a lot of what you can and cannot do. And really, to me, they would tie my hands behind my back. So I don't want to do that at all. So the only other way that I'm aware of to survive economically is to do something different, like concierge medicine. So that's the path I've chosen, and I think I'll be able to do a lot more for people in that model than I could in a hospital model. The challenges we face today are much more regulation all the time. And it's time consuming for us. You know, we may see a patient and you think, oh, he spent 15, 20 minutes with me, but we've got another 5 or 10 minutes of things to do to comply with all the regulations and do all this electronic charting and all the stuff that we have to do nowadays. So there's more and more regulations put upon us that, to me, don't serve the patient at all, and they don't serve me either. The only people that it serves is the government watchdogs and the insurance industry, who already has a total upper hand. So it's a losing battle. It's really kind of sad to see the changes that are going on. I worry about the young doctors just coming out in practice, and how in the world they're going to survive, I really don't know. So there are challenges, whether it's economic or otherwise, and they're time consuming. So time is so important. It takes away the interaction with the patient, because I just don't have time to do everything I would like to do. You know, the day-to-day challenges we face are, number one, the patient being able to get in. They can wait as long as 2 months. When they do get in, my time is constrained by the amount of time we can allow for the appointment. And I'm always, well, frequently, going overtime. And then I get behind, and then patients have to wait because I'm behind, and it's kind of my own undoing. But when I'm with the patient, I feel obliged to do things that maybe I don't have time for. So the whole time crunch is really difficult to manage. You know, getting appointments done is difficult to manage. If somebody needs to be seen the same day, that frequently goes to the nurse practitioner, because I just cannot do it. So concierge medicine is going to give me the ability to spend more time with each patient, to go deeper into things, to talk about things like berberine, that is a new to me at least, new herbal medicine. And at the same time, I have to keep up to date. I have to continually learn and read and go to meetings and up my game all the time. And that's also time that I don't have. So time is the critical issue. I don't have enough time for patients. I don't have enough time to fit everybody in. I don't have enough time to cover all the things that we might like to cover. And I just need time to continue to learn, to bring everybody new good stuff. So that's why I need to do something differently, as the concierge model allows me to do. Well, the patient is benefited by this model because they're going to have access to somebody who is up to date. they're going to be able to get in to see me in reasonable times, like the next day or 2 days later, or even same day if there's a critical situation that needs to be handled. So, so it'll be better for the patient to have access, better access. So the benefits of this change to me is that I can feel good about doing a better job. I think I can serve patients better, and that makes me feel good. I think I can take some time to keep my game going. In other words, continuing medical education. I think I can have more time to relax. I've been hitting it pretty hard for the past couple of years, and I'm not a spring chicken, and I need just time for me to recreate and rebuild, and I preach exercise all the time. I've got to have time to exercise too, and the way I'm running right at the moment, I really don't have enough time to do all those things that I need to do for me. So I got to keep me going so I can help keep you going, and that's what's in it for me. One of the really gratifying things to my practice is that I get to hear from patients all the time. When they come, we initiate a program, they come back. When they come back, I always ask, how do you feel? And some of the answers are absolutely, very gratifying, that they feel better, they have more energy. Women say, I haven't slept like this in 10 years. So the fact that they're feeling better, doing better, is very, very nice. But also, how you feel does not necessarily tell you what's going on in terms of inflammation, oxidation, glycation, and methylation. So we look at lab numbers for those, and we see lab numbers change. That's very gratifying as well, because I know we're putting off heart disease and cancer and diabetes and dementia, which are the things we all want to avoid. For the same amount of money you might spend on a cell phone, you can do this concierge model, and it'll do so much in terms of preventing the chronic diseases of aging. That's what we're really about, and I think we do it day in and day out. And so the advantage for the patient is just having access to that information, having a coach that pats them on the back or kicks them in the other part, just to keep things going and helping you get to your goal.